everybody. This is Kirsten Gilbert. I'm an occupational therapy student with Creighton University, currently doing a clinical rotation with the American Stroke Foundation. And today I'm going to talk to you about having confidence after a stroke. What is confidence? I want you to take a moment and contemplate, what does confidence mean to you? Confidence is self-esteem plus self-efficacy. So what the heck does that mean? Self-esteem is feelings of self-worth as an evaluation of self. Self-efficacy is judgment of one's capacity to engage in a task or an activity. So, feeling worthy of something and the belief that you can do something will lead to an increase in confidence. Are you unconvinced? Let's dig a little deeper. Self-esteem. According to research done by Park and Kim in 2016, self-esteem is considered a significant factor for emotional and functional outcomes of stroke survivors. There are multiple types of self-esteem, and they include state self-esteem, which refers to the aspect of a person's feelings of self-worth and is more subject to change in situations of acute or chronic stress, such as disease or unemployment. Trait self-esteem is developed throughout childhood and adolescence and is typically unchanged in adulthood. This is also considered the more enduring aspect of self-worth, and you can include in this section values and morals. And finally, there's lability self-esteem, which refers to the reactivity of state self-esteem to contextual and situational factors, and is also related to the vulnerability of depression. So, trait and state self-esteem usually are closely related, but that relationship is reduced when self-importance is compromised. Research indicates that the self-esteem of a stroke survivor contributes significantly to the total variance in a person's functional abilities 3 months post-stroke. This suggests that self-esteem may be important in understanding some of the previously unaccounted for variations in functional outcome experienced by certain stroke survivors, which basically means that some stroke survivors show greater improvements to others who have approximately the same limitations based on whether or not they believe in themselves and if they believe that they have the ability and capacity to improve their condition. Self-esteem is also impacted by caregivers, family, friends, support systems, etc. Moving on to self-efficacy. Self-efficacy is the ability to exert control over one's motivation, behavior, and social environment. It influences all manner of experiences, including goal achievement and performance. Typically, self-efficacy is measured by magnitude and strength, which is to say, the summation of the number of positive responses and the summation of the confidence ratings across all performance levels. Low self-efficacy might cause a situation where a person believes that they can't achieve a task regardless on whether or not they actually could, and so they avoid doing difficult tasks altogether rather than perceive it as something that they might be able to achieve. Self-efficacy can be used to help predict the quality of life and potential disablement post-stroke. Reduced quality of life is associated with long-term decline in functional independence and related depression. What impacts confidence? There are several factors that have been found in research to impact the confidence level of an individual, particularly someone who has suffered a stroke. And those include the loss of identity, fear, social confidence, role confidence, mastering skills, and their attitude and beliefs. Looking at those factors more in depth, loss of identity refers to the loss of skill, fear of being a lesser person, not feeling competent to engage in familiar tasks or roles such as washing the dishes and walking the dog. Fear refers to the fear of having another stroke, making a fool of oneself, or falling. And social confidence refers to confidence of being in a crowded place or feeling self-conscious. Role confidence refers to the ability and confidence to perform roles such as spouse, parent, worker, coach, etc. And this also includes the ability to learn how to push oneself again. Mastering skills would be gaining new skills or relearning skills such as cooking microwave meals to going to cook on the stovetop. This is done by improving small, achievable tasks to increase belief in self. And finally, attitudes and belief refer to success versus failure, reinforcement from a loved one versus giving too much help to an individual, and finding one's inner strength. I have listed here some key components of confidence according to fellow survivors, and they include having a purpose to life, feeling loved, doing well in their chosen roles, having hope for the future, and being content with who you are. I want to remind all of you of the need to advocate for yourself. You are survivors. You have gone through something that most people cannot fathom experiencing, let alone living with. You are strong and you are amazing and you are an inspiration to all of us. And I want you to remember always to be aware of the power that you have over yourself, especially when it comes to talking with your healthcare provider. You always want to make sure that your healthcare provider is on your side. We as healthcare providers are designed and should always be aware of ways to empower individuals with the skill set to set personal and target goals, manage symptoms, and gain functional progress. However, if you're not experiencing this or if you need additional support, don't hesitate to speak up. Advocate for yourself. You and your healthcare provider need to be on the same page and an understanding of your personal goals in order to help you determine your current level of confidence and emotional response towards those goals. Ways to build confidence after stroke. Remember that personal attitudes and beliefs combined with the attitude of a significant other or loved one contribute to a person's feelings of competence. Therefore, I urge all of you to refrain from comparing your pre-stroke self to your post-stroke self. Also, it is a great idea to look at the activities that you want to be able to do and rate them out of 10 on where your confidence level is. Also, I recommend setting your SMART goals. Braden did a presentation about this recently, and I'm sure you all remember it. Setting SMART goals that you can achieve and lead up to those bigger long-term goals is a really great way to not only measure how far you've come, but to really see your progress. Do things gradually and know your limitations. For an example, on days that you go to work, don't choose that same day to do laundry or cleaning. If you're going out in the evening, don't feel bad about relaxing during the day. There are also different milestones in your recovery that you need to be aware of. Recovery milestones viewed as a practitioner sometimes do not match those perceived by an individual, and research suggests that stroke survivors often have their own personal benchmarks for recovery, which may include aspects related to both physical and psychosocial outcomes. Rehab focuses a lot on functional milestones, which may not be the same as your personal centered goals. So again, it's important to work with your healthcare provider, your therapist, your occupational therapist, your friends, your family, and to tell them what your goals are. Tips for both survivors and caregivers. Keep a journal and don't worry about the spelling and grammar. Change your negative self-talk. I want you to work on doing your best and learning from your mistakes. If you make a mistake, don't criticize yourself. Instead, congratulate yourself on trying and celebrate your ability to try again. Visualize what you want to create in your life by picturing what you want, thinking of feelings of confidence or progressing in rehab. Take time to be alone every day and give yourself time to think, meditate, pray, journal, etc. Nurture yourself physically, emotionally, mentally, and spiritually. I have a challenge for each one of you. I want you to think about and look at what is still the same since your stroke and what is different. Write it down, talk about it with a friend, a family member, a loved one, or by yourself. And then I want you to take that and put it somewhere where you'll see it often to remind you of what you still have and also to think about what you have to work towards. Thank you all for listening, and I hope you have a great day.